I want to highlight this new full-time civilian social worker position. Over the last 3 years, our department has seen an increase of 100% in the number.
I do want to jump in a minute.
Please, Mayor.
This is not going to have the term social worker attached here. It's going to be mental health coordinator. So I want to clarify.
Thank you, Mayor. I appreciate that. Yeah. We believe the reason I'm using that term is when we look at the requirements and what we would like this position to be, someone, a licensed clinical social worker, preferably someone with a master's degree, would have the type of background that I believe would probably fit into this category, but it is not a social worker. It is just as the Mayor described.
Well, we're also looking more, as opposed to educational background, as a social worker, somebody with a background in psychology. That, again, I want to clarify what I'm proposing, and it is someone to be able to have some training in psychology, as opposed to social work, who can then help those who are in need navigate the system and provide some initial analysis so that they can get them to the right place. Social workers are not trained as psychologists, so we want somebody who has some psychological training and ability to evaluate. I don't mean to dispute what the chief has said, but I want to be very clear about what the administration is proposing.
Thank you, Mayor. Having said that, we are proud to partner with the Office of the Mayor and also with the Carmel Police Department. We have talked at length with Chief Barlow. They absolutely support this program. They do believe that there's a need in our community, and so we will be working closely with the Mayor's office and also the Carmel Police Department as the police officers are going out and they are responding on the same runs that we are. So we absolutely believe that this position is, it will enhance the quality of life. It will be able to help advocate for people in our community and help them navigate the system. I could tell stories about problems in the system where it comes down to navigation, explaining to someone to go to this website or to call this telephone number. Well, if they don't have a telephone or they don't have access to the internet, it becomes very problematic. So what we're trying to do is take a proactive approach and I've come before this body before, our goal is to take a proactive approach to what historically has been a 100% reactive business. If you look at the business model and how the fire service works and how police officers historically work, when there's an emergency, it's because an event has happened. And so we hope that with this program that we're able to take a proactive approach to meeting the needs of everyone in our community. And so that, in a nutshell, is the direction we're going. We've got a lot of data that we've collected from other communities that are doing similar programs. While those programs have proven to save money in their communities, I don't believe that their program would be the right program for us. And so what we're going to do is look at the needs, the unmet needs in our community, and take a proactive approach to it. And while we'll use the framework of other programs, we will make this program very unique to the citizens and to our community here in Carmel. So, kind of jumped out of there of line, I guess. Any questions about the new position that we've proposed?
Claire Austin.
Thank you, Madam President. Just so I can understand the role of this, and I 100% support this, especially on the police side. I know we've talked, people have talked about addressing mental health issues as a hard part, especially when you're dealing with dangerous situations where someone may have a disability or something going on. I think it definitely makes our police safer and our community safer. Just so I can understand how this person can be utilized, if, say, even there's a hoarder situation in a neighborhood and code enforcement responds and there's obviously a mental health situation going on there, could they utilize this person as well?
Absolutely. Even though the position and the salary and benefit package would be maintained within the fire department, it wouldn't be exclusive just to the fire department. So if building code needed assistance following up with someone, that person could do it. Again, the beauty of us starting this with the person who would head up the program, we can make the program into whatever we need. So we would be able to adapt. And this would not be a one-size-fits-all, but it would be a moving, flexible program that if there was an unmet need in the community, that person could help advocate both for the family and for the patient or the victim in some instances. And so, again, we're looking for someone to be able to connect the dots so that the people in our community are able to get the help and the resources that they need to move forward.
Just so
Perhaps
I understand.
I can expand on that, if I may, just briefly. I think it'll be helpful. We had quite a few discussions at the administrative level whether this position would be best housed in human resources, the police department, or the fire department. What it's meant to do is respond to people who live and work in Carmel who have a mental health issue, regardless of that issue. The police often are called on these issues. They try to calm everybody down. Usually there's a lot of emotions involved. Sometimes it gets better. Generally, they get called back in a few days, and there's a lot of frustration on the part of the police officers. They don't have the training, the expertise, or the resources to really help the situation the way it needs to be helped. And so other communities have put somebody who can, first of all, do an initial analysis of the problem. That's why I strongly believe it needs to have somebody with a background in psychology. And then the social work part comes in perhaps a bit, help them access the resources they need. But the person doing that has to be able to analyze what they need first to get them to the right place. That's why the psychology training, I think, is so important in looking at what other communities have done. Barb Lamb is currently polling, our HR director is currently polling a lot of job descriptions, getting a description ready. It's going to be included in the salary ordinance, which you'll see in a few weeks. So I want to be real clear about how we anticipate. Police get a call. It's clearly a mental health issue. Well, let's get this person out there with them or shortly thereafter to try to make sure that the right services, they know how to access them, they know how to get them paid for, and they get to the right place. That's the real key. We've seen some programs where we've got simply a social worker doing it, and they don't get them to the right place. So anyway, hopefully that's helpful. So
just so I understand, because I understand, and I know we got a lot to go through, but this is a position I'm sure we're all going to get a lot of questions about what it does. So it's a psychological background, so the person does more than just hand a brochure to people.
Oh, absolutely. This would be a hands-on, interactive position that would be out in the public and doing a lot of follow-up work for our community.
So just so I understand, where's the line drawn where someone can administer help in a situation, or where do we say, well, yes, there is a mental health situation, but this is beyond the government's role to get involved here? Where is that line drawn? It's hard. Yeah, that's a hard question. I know.
Right. I guess I'll put it in terms of how it's dealt with today. If there was a mental, emotional patient and the police and fire are called out, the fire department would try to encourage the person to go to get medical help. At the end of the day, if they refuse, we have an option to try to reach out to a physician to ask the physician to essentially medically force them to come. That takes time, and that is not an easy process. And doing that over the telephone, you could imagine the problems and the questions and the amount of time that's involved in that. The way that it gets dealt with currently, the police department have the legal ability to place someone and to detain them. The firefighters do not have that authority. And so the way it gets taken care of today is that if the person is a harm to themselves or someone else, an immediate detention will be will be placed on the person. They will be taken to the hospital and detained for 72 hours and then run through a psychological evaluation. That's the way it's being done now. The hope, to go back to what the mayor was referring to, let's just play that out for just one more moment, if you would all indulge me. That person goes, they make sense, they go through a battery of tests, they go back to the exact same environment that they just left. And then a few days pass, and then we go back out there again. And so it's almost like a tape reel. We go back out, we do the exact same things, we get to a fork in the road, either immediate detention or they go to the hospital. The hospital evaluates them, they get released, they go back home, they were okay when they were evaluated. They go back home, they're in the exact same environment, around the exact same people, and then we get called back out a few days later. And so what we're trying to do with this program is to intervene and change that cycle. And whether it's the mobile integrated health program that we implemented a few years ago, which takes a proactive approach to people who continually enter back into our system from a medical standpoint. It's about improving people's physical health and mental health. And the piece that we didn't really have through the mobile integrated program is the mental piece of this. And so that's what we're trying to incorporate with this position.
So we had a domestic violence incident in Carmel that turned deadly. And,
yes.
I can envision kind of getting those resources out there, but it must be difficult if the police got called out to neighbors who were, say, a husband and wife just yelling at each other, but nothing criminal has happened. Sure. Is it safe to say this person is not meant to be a marriage counselor, but
right.
I can see, I just want to make sure when you do hire this person that it's clear to the public what it is and also what it isn't. So we're not getting people trying to get a therapist at their door.
Yes, this is not. Thank you. Chief Google just succinctly put it. He's saving you some time here. Right now, the only link that currently exists is going through the hospital, and this person will be able to help navigate on behalf of the citizen